BlueGenes, the key to personalized health. BlueGenes is not just another medical test, it's a beacon of hope for you and me. It's a simple, yet powerful pharmacogenetics test that deciphers your genetic code to pinpoint which medications are most likely to be effective for you. And more importantly, it will tell you which drugs to avoid. Even in our veteran healthcare system, we face challenges of overprescribing due to the fact that we don't entirely know what drugs will work or not. Let's listen to a medical provider and veteran who is dealing with this very problem.
Well, so it's not always a veteran that's seeking the drugs. It's a interesting move, but I bring this as 1 month of pills from the VA that I didn't ask for, that the providers thought I needed. And I said to them, if I take all these, I probably won't wake up. This is 1 month. And so, with all due respect, trazodone to help me sleep, ropinirole, and
Is that on a daily basis?
This is on a daily basis.
Oh, someone take a picture of this.
So, but this is so it's not always the veteran that's asking for.
So it's basically being prescribed to them.
We're not looking at it from a
You gotta be
holistic
kidding me.
perspective.
This is.
There's two more. There's two more. These
Put
are-
them all out there. Yeah,
This is-
please, get this.
And so, if I take these together, there's a good chance I won't wake up. And thankfully, as a healthcare provider, I know I can't take this with this and that with that.
It's time to discover a better way forward. And BlueGenes is the answer. So how does BlueGenes impact the healthcare system in a meaningful way? Let's hear from the CEO and a Congressional staff briefing on pharmacogenetics and how BlueGenes intends to make a difference.
Test is a commodity. Anybody can run the test. The question is, what do we do when the information exists? Because the problem is pharmacogenetics doesn't fit in the current clinical workflow, and the information tends to become obsolete. What I mean by that is the test is once in a lifetime. It's not like COVID, where we tested ourselves every time we became symptomatic. Your genes are the same in 2023 as they are in 2043. And there are very few, if any, providers in America that are looking at pharmacogenetic data to make clinical prescribing decisions 5, 10, and 15 years after this test has been resulted.
So how does BlueGenes help the doctors interpret the results from the BlueGenes test?
The first thing we do is we simplify the data. It is a common misnomer to presume that the average provider understands how to apply this information, despite how easy my competitors make it seem with these red, yellow, and green drug selection options. So my company, BlueGenes, we have a patent pending API, and its very simplest definition, it is a push and a pull of information. We integrate with PBMs and EMRs. Now, this isn't an assessment of anyone's opinions of a PBM or an EMR, because they are simply vehicles in which we transmit information to make sure that we can impact how prescribing is done.
Once we receive a prescription, the quick process of approval or denial happens instantaneously, based on the genetic interactions of the patient.
When a script is sent in electronically, we capture data. Data like patient, provider, pharmacy, prescription. Our intelligence queries that data and sends instantaneous notification back saying, do not adjudicate this script. It is not genetically efficacious for patient. At that same moment, we send push notification to all the relevant parties saying the script that was provided is not advisable. Please choose from the following compatible drugs that are genetically compatible.
And it's easy to read the test results. Now the doctor can spend more time treating rather than trying to figure out what medication to prescribe.
This comes in a format that the providers can easily digest and easily apply. Now that there are other flaws in standard PGX testing that our software attempts to correct, and we can talk about those later today.
From antidepressants to pain management, from cancer therapy to heart medication, imagine fewer side effects, faster recovery times, and a higher quality of life. Unlock the secrets of your DNA and take the first step towards a healthier, more informed future. Learn more at www.bluegeneslab.com to explore the endless possibilities of genetic testing and personalized health insights. The future is coded in our DNA. Let's decode it together.